Our patient today had a lesion which was situated in a non-ideal position for resection. In this case, for instance, this patient had previous surgeries. He's got multiple comorbidities, and he's got a lesion which is not in a great position according to the surgeon. We're doing thermal ablation, so it's minimally invasive. We're going through the skin with a needle, and you're treating small lesions. So we have microwave ablation on the one hand, and we also have cryoablation.
The cryoablation technology is, firstly, it starts with something called extracellular freezing. So this is basically where ice forms outside of the cell membranes. Water will be drawn out of the cells, and this causes our cells to shrink and actually become damaged. The second process of the freezing is when intracellular damage occurs. The organelles like the DNA and the mitochondria and everything within the cell becomes damaged, and that actually leads to the actual destruction of the cells.
The patient goes onto the CT bed, and we have to decide which position just to access the kidney the best way. And then we do a planning CT so we can plan our approach. And then after that, the patient is draped, sterile, cleaned, local anesthetic, and then the needle goes through the skin. And then we use CT fluoroscopy, which is just a more active and low-dose CT screening to put the needle down into the lesion, and then do another scan to confirm where we are. Once you're happy with your needle placement, you can start with the actual treatment.
It's typically a one-day treatment, so the patients would come in for treatment today and typically can get discharged either later that day or the following morning.
I think it went very well. I think the nice thing about cryo, which is different, is you can actually see the ice ball, so you know exactly what you're treating. And that's one of the benefits of cryo, that you are more confident in what you've treated. Under-treating is probably the biggest complication of this therapy, and the nice thing is, even if that happens, you can do a second treatment without having to go to surgery. And the patients generally, when you get to them, have little pain. They often don't need to go home on any painkillers, and their recovery is really very smooth afterwards, very little pain. So yes, I feel good. It was a bit stressful, the first one, but very happy with the outcomes.